Have you ever wondered why doctors ask us about our personal experiences, like our traumatic experiences, friends, school, physical health, and maybe our state of mental health? Good afternoon. I, Ricky Luis and Nage, together with my team, will be explaining about the biopsychosocial model. The biopsychosocial model is an interdisciplinary model that looks at the interconnection between biology, psychology, and social and environmental factors. The model specifically examines how these aspects play a role in topics ranging from health and disease to human development. George Angle came up with the idea in 1977. It was for the goal of preventing and treating disease. Basically, it helps physicians in gaining a better understanding to their patient. Let us now learn more about George Angle.
Good morning everyone. I am Princess Maraja Abalas and I am going to discuss about George L. Engel. George Liebman Engel was born on December 10, 1913 and died on November 26, 1999, was an American internist and psychiatrist. He spent most of his career at the University of Rochester Medical Center in Rochester, New York. He is best known for his formulation of the biopsychosocial model, a general theory of illness and healing. Engel received many awards and honors from the American College of Physicians and the American Psychiatric Association for his work. Furthermore, he stipulated that there is a scientific necessity to consider psychosocial aspects of patient history to provide the most complete diagnosis and treatment plan. Along with his biopsychosocial approach to the patient, Engel also contributed heavily to research and to education of medical students. His legacy is one of the most compassionate and scientific doctoring. Thank you, and let's move on to the next reporter.
Good morning, I am Vince Carlo El Isidro. This model is commonly used in chronic pain with the view that the pain is a psychophysiological behavior pattern that cannot be categorized into biological, physiological, psychological, or social factors alone. There are suggestions that physiotherapy should be integrated with psychological treatment to address all components comprising the experience of chronic pain. Okay, so chronic pain is viewed as an illness which cannot be cured but only managed, as this will come and go. Therefore, the biopsychosocial perspective is directed at the illness rather than the disease itself. And this approach focuses on the diversity and the individual differences biologically, psychologically, and socially. Or in other words, biopsychosocial model states that workings of the body, mind, and environment all affects each other. Thank you, and let's move on to the next reporter.
Good morning everyone. I am Harold Ramos. So this diagram shows how biological, psychological, and sociological factors overlap to determine overall health. So on biological factors, it includes physical health, disability, and general vulnerability. So in psychological factors, it includes self-esteem, coping skills, and social skills. And lastly, the social factors, which includes the peers, family circumstances, and school. Thank you, and let's proceed to the next reporter.
Good day everyone, my name is Daniel Henry A. Corpus and I will be tackling about biological influence on health. Biological influence on health include an individual's genetic makeup and history of physical trauma or infection. Many disorders have an inherited genetic vulnerability. The greatest single risk factor for developing schizophrenia, for example, is having a first-degree relative with the disease. Risk is 6.5%. More than 40% of the monozygotic twins of those with schizophrenia are also affected. If one parent is affected, the risk is about 13%. If both parents are affected, the risk is nearly 50%. Some biological and genetic factors affect specific population more than the others. For example, older adults are biologically prone to being in poorer health than the adolescents due to the physical and cognitive effect of aging. Sickle cell disease is a common example of a genetic determinant of health.
Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So good morning, I am Lovely Pearl Dabne Arellano. Social influence on health. Social factors include socioeconomic status, culture, technology, and religion. For instance, losing one's job or ending a romantic relationship may place one at risk of stress and illness. Such life events may predispose an individual to developing depression, which may in turn contribute to physical health problems. The impact of social factors is widely recognized in mental disorders like anorexia nervosa, a disorder characterized by excessive and purposeful weight loss despite evidence of low body weight. The fashion industry and the media promote an unhealthy standard of beauty that emphasizes thinness over health. This exerts social pressure to attain this ideal body image despite the obvious health risks. There are four psychological factors. First is motivation, arousal and anxiety, personality, and also the concentration. So that's all, and thank you. Let's move on to the next reporter.
Hello, this is Mark Angelo and I will be discussing the cultural factors. It is also included in the social domain, which are cultural factors. For instance, differences in the circumstances, expectations, and belief systems of different cultural groups contribute to different prevalence rates and symptom expression of disorders. For example, anorexia is less common in non-Western cultures because they put less emphasis on thinness in women. Culture can vary across a small geographic range, such as from lower income to higher income areas, and rates of disease and illness differ across these communities accordingly. Culture can even change biology, as research on epigenetics is beginning to show. Specifically, research on epigenetics suggests that the environment can actually alter an individual's genetic makeup. For instance, research shows that individuals exposed to overcrowding and poverty are more at risk for developing depression with actual genetic mutations forming over only a single generation. For example, some parts of the world with different cultures have different lifestyle affected by their culture and teachings. Those choice of food that is not likely with other cultures and how they handle themselves can manifest different kind of diseases more oftenly than those with more body and health friendly vices of other cultures.
Hi, good day. I am Alexander Pasqua. I'm going to discuss about the biopsychosocial model, which means that each one of these factors, like bio for physiological pathology, psycho for thoughts, emotions, and behaviors, and social like work issues, and family circumstances and the like. It is not sufficient to create health or mental illness, but the interaction between them determines the course of one's development. So, what affects the mind also affects the body. So, wellness or illness is not simply a matter of physical state, rather, it is also influenced by the person's psychological and social states as well. So, here is the application of the biopsychosocial theory or the model. It states that the workings of the body, mind, and environment all affect each other. So, according to this model, none of these factors in isolation is sufficient to lead definitively to health or illness. It is the deep interrelation of all three components that lead to a given outcome. So, health promotion must address all three factors, as a growing body of empirical literature suggests that it is the combination of health status, perceptions of health, and sociocultural barriers to accessing in health promoting behaviors like taking medication, proper diet or nutrition, and engaging in physical activity. So that's all on my part. Let's now move on with the next reporter.
I am Arvin Carion, BSN 1 to 8, Kari Martinsen. Application in medicine. A way of looking at the mind and body of patient as two important systems that are interlinked, so the working of the body can affect the mind and the workings of mind can affect the body. Interview process should encourage the patient to give as much information not about the physical symptoms but how illness affects the patient.
So now, let's discuss on how to apply biopsychosocial model in clinical practice. First, recognize that relationships are central to providing healthcare. Second, use self-awareness as a diagnostic tool. Third, elicit the patient's history in the context of life circumstances. Fourth, decide which aspect of biological, psychological, and social domains are most important to understand and promoting the patient's health. And lastly, provide the multidimensional treatment. That is all, and let's move on to the next reporter.
Good day everyone, I am Patrick Sampson and I am your reporter for this slide. According to the biopsychosocial model, it is the deep interrelation of all three factors which are biological, psychological, and social that leads to a given outcome. Each component on its own is insufficient to lead definitively to health or illness. The psychological component of the biopsychosocial model seeks to find a psychological foundation for a particular symptom or array of symptoms, for example, impulsivity, irritability, overwhelming sadness, and etc. Social and cultural factors are conceptualized as a particular set of stressful events or being laid off, for example, that may differently impact the mental health of people from different social environments and histories. Despite its usefulness, there are issues with the biopsychosocial model, including the degree of influence that each factor has, the degree of interaction between factors, and variation across individuals and lifespans. And now let us proceed to next reporter.
Good morning. I am TJ Locobert. Limitation of biopsychosocial model. Despite its usefulness, there are issues with the biopsychosocial model, including the degree of influence that each factor has, the degree of interaction between factors, and variation across individual and lifespan.
And that ends our report. Thank you for listening, and I hope you learned something about the biopsychosocial model.